Welcome everyone again, and in this lecture, I will talk to you about the trachea and bronchial tree. So, first of all, let me give you just a brief introduction about the conducting zone of lower respiratory tract, and what you can see in this figure is the trachea here that bifurcates to main right and left main bronchus, then the main bronchus divided into secondary, that in purple color, then the secondary divided into tertiary, or what we call segmental. So which you have see also the right lung and the left lung. The right lung has three lobes, the superior, middle, and inferior lobe, but the left lung is a little bit smaller because of the presence of the heart. So it has two lobes, the superior and inferior lobe. But today, as I mentioned in this lecture, we'll talk about the trachea. And when you look to the trachea, we remove the lung here, and you have just the trachea and the bifurcation here. So the trachea in this cross section composed from cartilage, but not just cartilage, but also it's a cartilaginous and membranous tube. This is the cartilage, which is like a C shape. So you have like 16 up to 20 C-shaped tracheal cartilage and covered by posterior, of course, lined by membrane, covered posteriorly by trachealis muscle that you see here. So this C-shaped cartilaginous rings that we have up to some 16 up to 20, they form the trachea. So trachea started, this is the thyroid cartilage, this is the cricoid cartilage. So from here, from at the level of C6, cervical vertebra number 6, the is the start of the trachea, which is about 12 centimeter, 12 centimeters long, and the diameter about 2.5 centimeter. So 12 centimeter long, 2.5 centimeter diameter. So what else? So the trachea, as I mentioned, at the level of C, started from C6, which is the continuation of the larynx. The larynx was here, so once the larynx ends, the trachea started. And again, the presence of the cartilage in the trachea give it like it reinforce and provide like rigidity for the trachea wall, so make sure that will not collapse or close, so keep it always open. So it's important to know we're started from the lower part of the larynx from C6 until it bifurcates at the level of T4, T5. You remember that from the previous semester when we talked about the sternal angle, and we said that you can put your finger in the jugular notch here and move a little bit down. You will get like elevation on the sternum, on the surface of the sternum. This is the sternal angle, in which there is a second rib, costal cartilage, the costal cartilage of second rib attached here, right and left. So the sternal angle at the level of T4 and T, between the T4 and T5, if you go on a horizontal plane to the back. So the trachea mainly in the midline, but once before the bifurcation, it a little bit deviated to the right, a little bit, right? So yes, this is the trachea that bifurcates at the level of T4, T5, between T4 and T5, or at the level of a sternal angle, thoracic vertebra number 4 and 5. So this bifurcation point, known as Carina of trachea. Here is like internal view of a trachea. It bifurcates into, say, right and left main bronchi, and this area is known as the carina of trachea. So the carina of trachea, guys, is a most sensitive area of a trachea and larynx for triggering cough reflex. So you imagine you swallow, for example, or there is a mucus or whatever, a foreign particle lodged here, once go through the trachea, it hits this area, this very sensitive area. So once hit it, this initiates the cough reflex, right? So this is the carina of the trachea, the most sensitive area in the trachea and larynx. So the trachea at the level of T45, at the carina here, the bifurcation of the carina of trachea divided into right main bronchus, the green one, and left main bronchus. Now, before talking about the bifurcation and the bronchus, bronchioles, and the divisions of the bronchial tree, let us, which is very important, clinically and in the exam, we usually ask about the relation of trachea and the neck. So the relation of trachea in the neck, then we'll talk about the relation of trachea in the superior mediastinum. So in the neck, that means above the mediastinum. This is the first rib. So above the first rib is the neck, right? But from the first rib here to this angle, which is between, say, T4 and T5, is the superior mediastinum. So sorry, here guys, I would use this figure in which here's the larynx and here's the beginning of a trachea. So in this area, guys, you expected in the neck anterior to the second, third, and fourth rings of the trachea, there is isthmus of thyroid gland. This is the thyroid gland, and this is the isthmus of thyroid gland. What else anteriorly? You have anteriorly the inferior thyroid vein. You see here. You see it anterior to the trachea in the neck. Furthermore, you have the jugular notch here or arch, and you have it's overlapped also anteriorly by the by two muscles, the sternothyroid and sternohyoid. So from sternum to the thyroid, this is sternothyroid, and there's one higher than it, which is sternohyoid to the hyoid bone. Yes, of course, on the right and on the left. This is anteriorly. Now, posteriorly, so now posteriorly, let us look at this figure. Again, this is the trachea in the neck. Posteriorly, you have the esophagus. You see here is the esophagus. But between the trachea and the esophagus, you have the right and left recurrent laryngeal nerves. Those recurrent nerves from the right and left vagus nerve, right? Right vagus nerve and left vagus, both they give. This is the right vagus nerve. Then at the just inferior to the subclavian, it gives like a recurrent laryngeal nerve up, and this is the left vagus nerve, but it descends down until it reaches the arch of aorta. Then it reflected. You see the shadow of it. Then ascends up between the trachea and the esophagus. So you have the esophagus and right and left recurrent laryngeal nerve. This is posterior to the trachea. Yes, we finished anterior and posterior. Now, let us, again in the neck, let us see what we have on the right and on the, or say on the right and left, I mean laterally. Very simple. You see this is a trachea. So lateral to it, you have the lobes of the thyroid gland, the right one and the left one, plus to the carotid sheath with its content, with its contents, including the common carotid artery and branch, and internal jugular vein, and vagus nerve, and deep cervical lymph node, and yes, part of laryngeal branch of laryngeal nerve. So this is laterally. Now, what about the relation of the trachea now in the superior mediastinum? Well, it's pretty easy because mainly covered in the previous semester. So in the superior mediastinum, that means I would say from this level right up to the this sternal angle level, the dotted line, T4 and between T4 and T5 vertebral level. So what's the relation of a trachea here? Okay, anteriorly you have the sternum, of course, right here, and you have a remnant of thymus gland. Okay, now, and remove it. So what else? Anteriorly, when you remove the sternum and thymus, remnant thymus gland, you will get the left brachiocephalic vein, because it crosses from the left all the way to the right to join its brother, the right brachiocephalic vein. Anyway, so anteriorly, when you remove the sternum, behind the thymus, behind it there is left brachiocephalic vein. Remove the left brachiocephalic vein, you will get the origin of brachiocephalic trunk and the origin of left common carotid artery. And that's these structures located anterior to trachea. Now, posteriorly, as I mentioned, you have the at this level in the superior mediastinum, right? In the superior mediastinum, you have the esophagus. Yes, you have the esophagus basically behind it, and you have just the left recurrent laryngeal nerve. Why? Let me show you here. So this is the level of superior mediastinum, for example, approximated. So behind the trachea, you have the esophagus, yes, but at this level, look at the right recurrent laryngeal nerve. This is vagus nerve below the subclavian. It gives like the right recurrent laryngeal nerve. Then the vagus continue on the right. But on the left, no. The left vagus descends down, down, down until it reaches the lateral surface of the arch of aorta. Then it gives this recurrent branch, then ascends up. That means in the superior mediastinum, in this level, you will find the left recurrent laryngeal nerve just, but the right, no, the right is up in the neck. So that's why you have just the left recurrent laryngeal nerve. The vagus is like this and gives it there. So on the right here, you have the right vagus nerve. Yes, we cannot ignore that. And you have the azygos vein here. Let me show you here. Yes, this is the trachea and the superior mediastinum, and this is the right vagus nerve, and also to the right of it you have a zygos, the arch of azygos vein. On the left, yes, you have the left vagus nerve, but also you have these structures. Okay, they use this no, I will use the red one. So laterally here on the left, that was on the right. On the left, you have the left vagus nerve here, and you have the arch of aorta. Look at it here, the arch of aorta, and it has the to the left of it, left common carotid and left subclavian, right? So these structures to the left of the trachea in the superior mediastinum. It's also important in the exam. Now, it's good to remind you guys with the relation of the trachea and bronchi to the pulmonary trunk. You know that the pulmonary trunk arises from the little bit to the left from the right ventricle, then ascends up toward the left direction, then it divides at the level of approximately below the level of T4, T5, below the sternal angle. I would say at the level of T5 vertebra, and it gives the right pulmonary artery and left pulmonary artery. Okay, so first of all, the right and left pulmonary, the right and left pulmonary artery both branch anterior to the right bronchus and left bronchus, right? So the right pulmonary artery, as you see here, is anterior to the right bronchus, while the pulmonary trunk and the left pulmonary artery anterior to the left. Yes, that means most posteriorly is the bronchi. Okay, now you have to know that the left pulmonary artery, yes, it's anterior to the bronchus, but it's posterior to two great vessels, which is very important. This is the aorta, and this is the ascending aorta, and this is the superior vena cava, right? So, behind the ascending aorta and behind the superior vena cava, you have the left pulmonary artery, right? You have the left pulmonary artery. Always I make like this: left pulmonary artery, then 1 2, which is the ascending aorta and superior vena cava. But on the other hand, another interesting relation here, which is I would like guys to know that the um, left, you see the arch of aorta, the arch of aorta arcs over the left, over the right pulmonary, over the right pulmonary artery, right? And the descending aorta, um, back to the left, because the descending aorta moved to the left, right? So the descending aorta passes behind of everything, behind the left pulmonary artery and behind the bronchus. Look at it here. So this is the descending aorta, behind of everything, behind the left pulmonary artery and behind the left bronchus. So you have to know this orientation. Why? Because when you have a CT, for example, this is anterior and this is the vertebra, which is posterior. So again, when this is anterior, this is part of the sternum. So most, as I told you, like this and this sign you have to remember. So this is the right pulmonary, this is pulmonary trunk, of course. This is a pulmonary trunk. So this is the right pulmonary artery, and this is the left pulmonary artery. Now the right pulmonary, you remember this arrow, this with a shape, this is the right pulmonary artery, and anterior to it is the ascending aorta and superior vena cava. Again, this is the right pulmonary artery, anterior to it is the ascending aorta and superior vena cava. Right. On the other hand, we mentioned that the bronchus is most posterior, right? Yes, but not the descending aorta, because descending aorta behind of everything. Behind, I mean the left and left pulmonary artery and left bronchus. This is left pulmonary artery, and this is the left bronchus space, and this is the right bronchus. So this is the descending aorta, right? This is the descending aorta. Again, so when there is, so you have to know these structures. So when, for example, in this case, you have impulse here, a case of pulmonary embolism, in which look at this is a pulmonary trunk here with the of course right pulmonary artery and the left pulmonary artery. Again, this is the same as the above, but look at the impulse here that close the right and left. It's like a saddle. It closed both arteries, right? This is an example of pulmonary embolism. In bronchial tree, I will show you how the trachea now divided couple of times, and what we call each division. So the first thing, when you look at it here, I'll use the blue. This is the trachea, and at the carina of trachea, the level of T4, between the vertebral T4 and T5, the trachea divided into right main bronchus in green and left main bronchus. And then the main bronchus, it's main, right? Main bronchi you have. They, once they enter the hilum, of course, in the right, it divides as soon as it enters the hilum. But the left bronchus, will divide inside the lung. That means, say, this is the hilum, so the left bronchus passes the hilum and gets in the lung parenchyma and divides inside the lung itself. So when you take a cross section at the hilum, you will see just one opening, but the right bronchus will not wait until it gets into the lung. No, it divided at the hilum, at the entrance of the lung. So if you take a cross section, you will see that the main bronchus divided early in the hilum to give a bronchus to the superior lobe here, right? You will get two opening, one for superior lobe and one will divided later to middle and inferior, one to the inferior lobe. So most importantly here, to at this level, we'll talk about it in the lung, but here you see that trachea divided into main right and left main bronchi. Okay, of course, the main will divide it into secondary in the purple color. I don't know if we have, yes, we have a purple color here. So the purple color is we call it the secondary bronchi, or we call it lobar bronchi. So the main bronchi divided into lobar or secondary bronchi. And in the right, you will see here is one for the superior lobe and one to the middle and one to the inferior. But on the left, you will get one to the inferior and one to the superior. That, of course, divided later, because you have two lobes here, but here you have three lobes. Anyway, so this is the secondary bronchi. Now the secondary will divide into tertiary bronchi, or we call it segmental. You have to know both segmental or tertiary bronchi. So the secondary or the lobar bronchi divided into, as you see here, into segmental, because each lobe will divided into segments, right? For example, the right lung has 10 segments, the left lung has 8 to 10. It divides if fused or not. So each lobe you see here will also divide into segments. So these are called segmental bronchi, right? If you have, for example, 2 or 3, so the secondary will divide it into 3 segmental bronchi. But this is not everything. We'll talk more about this division, but let us have an idea about the right and left main bronchus most importantly. So look at the right main bronchus. It's like, this is the right main bronchus, which is like wider, number one, shorter, compares of course to the left. It's wider, it's shorter, and it's more vertical compared to the left. The left is longer, about 5 centimeter. It's narrower, and it's more horizontal. Like if the right like that, the left would be like relatively like that. So what does it mean? That means if you have a child coming to the ER swallowing a kind of foreign particle, you have to expect mainly you have to expect, even before the x-ray, that the foreign particle will lodge in the right main bronchus. This is very important. This is very important. So you have to expect the foreign particle will lodge here in the right main bronchus. Why? Because it's wider, because it's more vertical, and these are mainly enough to receive the foreign particle, wider and more vertical compared to the left. So it's about 2.5 centimeter, and the main bronchus, the right main bronchus, divided early in the root of the lung, which is very important. As I mentioned, this is the line that indicates the I would say the root of the hilum of the lung. So the right main bronchus, let me erase it. So the right main bronchus, when it reaches the hilum, it divides directly. It gives a bronchus to the superior lobe called superior lobar bronchus, which is the secondary bronchus, right? Superior lobar bronchus, and another division. The other division will get in the lung, as you see it beyond the line. So, and it gives middle lobar bronchus to the middle lobe, and inferior lobar bronchus to the inferior lobe. So, because you have three lobes, right? One to the superior, middle, and inferior. But that to the superior lobe arised early at the hilum of the lung, but the other no, they divided inside the lung. But on the left, guys, although we have a slide to the left, so as I mentioned, it's narrower, it's longer, about 5 centimeters, not 2.5, and you see this is the hilum of the, say, the hilum of the lung, like this. So it gives nothing at the hilum, but once it gets inside the lung tissue itself, then inside the lung it divides into a lobar bronchus for superior lobe and one to the inferior lobe, as you see here. Then of course the secondary will divide again. The secondary or the lobar bronchus divided into segmental bronchi. So that's maybe guide us to understand or dig a little bit more deep and repeat what we mentioned about the division. So you have the trachea divided into right and left main bronchi. The main bronchus will divide into secondary one, which is called lobar bronchus. You see here, this is the secondary or the lobar bronchus. Then the secondary secondary or lobar bronchus divided into tertiary bronchus, or we call segmental bronchi. So the segmental bronchi, will talk to you about the segments of the lung in the next lecture, but you have to know that each lobe will then divide it into segments. We call it bronchopulmonary segments. Bronchopulmonary segments. Anyway, but for this level, now the segmental bronchi or the tertiary bronchi then gives bronchioles or conducting bronchioles. The conducting bronchioles then divided, of course, this is of course inside the lung, because you know that segmental bronchi, even the secondary, all inside the lung. Okay, so the segmental bronchi divided into conducting bronchioles, now shifted to something called bronchioles. So these bronchioles or conducting bronchioles divided into terminal bronchioles. Then terminal bronchioles gives respiratory bronchioles with like small alveoli or bulges here, shown here. When you see these bulges, you have to remember the respiratory bronchioles now. Now, respiratory bronchioles gives alveolar duct. Alveolar duct open into alveolar sac. Alveolar sac has many alveoli, you see here, right? So this is the end of the alveoli. But I think it's good to remind you that I mentioned that there is segments. Yes, each lobe divided into couple of segments. Each segment structurally, surgically, functionally can be distinct and separated. That means if you have an affected segment in the lung, you can remove it with its lymphatics, blood supply, nerves, and bronchioles. So look at the dotted line. This indicates that you have segments in the, for example, this is the lung, so this is the lobe, so it has segments with like pyramidal shape. This segment separated from the other one by connective tissue septa, so these are septa, and it has its own bronchioles, own lymphatic vessels and nerves and the blood supply, and separated from the other one by deep by a connective tissue septa, and the veins are located intersegmentally. That means pulmonary veins, you see here, between segment, there is another segment here, there is another segment here. So between the veins, the pulmonary veins located between segments, we call it intersegmental veins. So yes, as I mentioned, no, this is to the next lecture. So lastly, I would just remind you with the blood supply of the trachea, in which it's very simple. This is the I will use this color. So I think you remember from the previous semester the inferior thyroid artery. The inferior, you see the this is the inferior thyroid artery, guys, here and here. So inferior thyroid artery is a branch of thyrocervical trunk. From the first part of subclavian artery, there is thyrocervical trunk from its name, thyrocervical. That's something related to the thyroid and neck. It gives the inferior thyroid artery that supplies the upper 2/3 of the trachea, while the lower third from the, you see here, from the descending aorta, it gives a bronchial arches, right? So this is the artery. What about the vein? So the blood drained into inferior thyroid venous plexus, you see here. Now, the nerve supply of trachea, because it composes from a cartilage and cartilaginous structure, and it has also a trachealis muscle posteriorly. This is the cartilage ring, and here is the trachealis muscle here. So you have to know that the nerve supply, the sympathetic nerve will supply the trachealis, but parasympathetic, because trachealis muscle is smooth muscle. Smooth muscle, that means autonomic nervous system. So autonomic nervous system, that means you have sympathetic and parasympathetic. So sympathetic nerve supply the trachealis muscle, but the parasympathetic comes from the vagus nerve. Well, finally, yes, this is the larynx, and this is the beginning of the trachea here. And you can say this is the second ring, third ring, fourth ring, and so forth. If there is an obstruction anyway in the airway, for example, in the throat or in the larynx, especially in the larynx, for example, if there is a tumor in the larynx and so forth, so that blocks the air from driven inside the lung. So the solution is to open an opening in the neck, as you see here, in the between, I would say, in the second and third tracheal ring below. This is the, let me remove this and to show you. Sorry. Let me erase these things. So you remember the thyroid cartilage, Adam apple, and below it you have a cricoid cartilage. You can palpate both of them. Just below the cricoid cartilage is the first laryngeal ring, the second laryngeal ring, and the third one, which is the safest area between the second and third tracheal ring here to create an opening for something called tracheostomy. Tracheostomy is a tube inserted through the larynx, anteriorly into the trachea if there is obstruction here in the neck. So it can, the patient can breathe either permanently or temporarily. So this is about the trachea, and I would say hope you find value in it. Thank you.